Well, Gauteng is recording thousands of new infections daily. This, of course, is dramatically higher than other provinces and what they're currently reporting. The NICD has been monitoring the infection rate and the Omicron variant. Joining me now is Professor Adrian Puren from the National Institute for Communicable Diseases. Thanks for your time again, Prof. Always a pleasure talking to you. So let's talk first about what more you've been able to establish in terms of this Omicron variant. It's been just about 2 weeks since the public found out about it, but I know you've been closely monitoring it.
Yes, there's no actual new news, as it were. I think we continue to be in the state of, carrying out the various research efforts that are ongoing. In particular, I think understanding around vaccine efficacy, I think that's going to be a critical point. So I think those data points, I hope will come through in order for us to really understand, in the context of Omicron, whether or not we still have a level of protection. There's also the laboratory-related work as well that needs to go hand in hand with those types of research in order for us to really understand whether or not, from a laboratory perspective, again, Omicron, in terms of evades the immune system, and if it does, is it purely the antibody responses or is it the T cell responses? I think there's been a lot of theoretical modeling that has been published, and again, not all of this is peer-reviewed. But again, the evidence does show that there may well be changes with regard to immune evasion, but the extent may well be quite significant in some parts, but perhaps the T cell responses may still be intact. So I think what has not changed dramatically is that those types of information, as well as critically, I think the other important point is that we're really looking not just at the numbers of cases, which I think is very dramatic. I think what is key now is to monitor the hospitals. Again, the data from there, and again, the numbers are small, seem to suggest, again, that the disease may not be as severe. But again, I would really like to caution the public that we are at the early phase of this trajectory, and that we need to really wait and see. Nevertheless, I'm sure that within the different provinces, plans are in preparation, if not initiated, to ensure, given these large numbers of cases, because again, the proportion of cases may lead to systems being overwhelmed, so it's really key that hospitals, in terms of their oxygen supply, bed capacity, staffing, are ready.
Yeah, so it's interesting, right, because we've recorded at least 16,000 cases in one 24-hour period on the 4th of December, and we're seeing the numbers around hover there. But are you saying that we're seeing less hospitalizations? And if you can, compare these numbers and hospitalizations for us compared to the previous wave.
Yeah, so again, as you know, hospitalizations are really a lag indicator, as it's called. So I think we're only going to really see within the next week or two in terms of whether or not indeed there are certainly increases in hospitalizations, but the nature and extent of that in terms of who's coming to hospital. Are they vaccinated or unvaccinated? What's the extent and severity and clinical picture in those particular instances for us really to understand whether or not this is a more severe virus in terms of pathogenicity? So I think the hospital-based data combined with the vaccine data, I think is really going to be really critical for us to try and answer some of those key questions. Therefore, I think there have been reports, and I know the MRC has released a report around hospitalizations in Tshwane, which seems to indicate that the severity compared to the previous resurgence is somewhat different, and therefore milder in the context of, for example, the requirement for oxygens and ICU bed capacity. Yes.
The Gauteng government issuing a statement saying that around 1,670 people are actually hospitalized in this province alone. Is that a concerning figure for you? Of course, given the context, what you're saying regarding hospitalizations and numbers.
Yeah, so I think it's always of concern that we're seeing an increase in the numbers, but I think this time around I'm sorry to be repetitive, but I think what is important here is who is being hospitalized. Because I think from a public health initiative perspective, if it's the unvaccinated, again, from a public health intervention perspective, then that's a critical piece of information that the public really needs to know, that if you remain unvaccinated and you're in a specific age group with particular comorbidities, then that's those are the people that we need to target to be vaccinated. If it's the vaccinated, then yes, and it's no different from the unvaccinated, then yes. And that, again, tells you about the fact that Omicron may well be evading our immune systems and causing severe disease. So those are the types of questions that we really need to answer when we look at those 1,600 cases.
Yeah. How long before you actually to come to some conclusion about this new variant and how severe or not it is?
I would think in the next 2 weeks or so. I think that there is, again, we have some hospital numbers, but I think, again, we need to be cautious about those particular numbers. They may be small and for us to really interpret well. So I think within the next week or two, I hope that we'll be able to come up with more definitive answers.
Yeah, every day feels like a week when it comes to this virus, doesn't it? Okay, so let's talk about the concentration of numbers in Gauteng. Why is it so high here?
I think it probably, again, one can speculate, but I think the key here is that we do know that there were clusters and events that may well have been associated with initiating these particular, setting off the transmission and setting off community transmission. So that may well be a possible explanation, that perhaps the initial seeding here was more dramatic and therefore spread more rapidly. And as you've seen, in the previous resurgence, that in fact we did have a marked heterogeneity. Provinces really behaved very differently from each other in terms of when cases started to rise and to peak and decline. So again, I think that this resurgence may well be very similar to what we're seeing. So I think you can already see that although the initial trajectory has been very significant in Gauteng, we're starting to see that in other provinces like the Western Cape and KZN, the Northern Cape as well.
And Prof, just in terms of the holiday season, of course, we know that everyone stuck inland tries to go to the coast for the December period. Is that going to lead to dramatic increases in those provinces, given the concentration of numbers in Gauteng right now?
Yes, so I think that mobility certainly contributes to that because, again, if the more people move, the closer the contact. And again, I know we try and stress around so-called safe bubbles or safe pods, but these are concepts, and I think people do not always adhere to that. We can certainly talk about the non-pharmaceutical intervention, and I think we need to stress that. So there'll be different points along the route, if you like, that they are going to be at risk. They're going to be at risk when they're traveling, maybe not to the same extent, but of course, when they start to mix, and that's where I think the problems really would start. So again, I think we're advising against indoor events. We're certainly still advising that there must be physical distancing and the wearing of masks, and rather have outdoor events and keep the numbers small. I think we all need to, and I know it's very difficult. I think that we're under severe stress and there's lots of mental strain out there, but I think we still need to be cautious and assess our risks. I think that's really going to be critical. Whether is this travel really critical? Is it important? And what are the implications and how do we keep each other safe? I think this time around it's a bit different. And again, I come back to this particular point about vaccination. Here is an opportunity for us to really enhance our safety. And I, again, would encourage the South African public to really take advantage of this opportunity to be vaccinated. Yes, there are risks of your becoming infected, but you can certainly diminish transmissions, and you can avoid serious infections leading to hospitalization.
We were hoping to actually get the numbers released during this interview with you, the latest figures. Of course, the NICD does release them. Can you hint at all whether it's higher than yesterday?
I'm afraid I don't have a clue at this particular point, yes.
Okay, I was just trying to...
No, it's not because I know, but I think it will come through.
Okay, thank you so much for your time and your insight. Appreciate it. Professor Adrian Puren from the NICD.